Even after being released from quarantine, many still suffer from post-COVID conditions like dry coughs and fatigue. Research shows such symptoms can last for weeks, if not longer. Suk-hyen explains further.
Quite a few people who've suffered from COVID-19 still experience symptoms even after their release from isolation. Like this man who tested positive last week and is now out of quarantine.
My quarantine is over, but I still have a tickle in my throat, and it's been like that since I got confirmed. I do cough, but it doesn't hurt. It's just that my throat is itchy.
This condition, known as long COVID or post-COVID-19 syndrome, can last for weeks or months. In fact, research shows that most patients will fully recover within 12 weeks, but for some, it may last as long as a year. The most common symptoms appear to be cough, fatigue, chest pain, brain fog, dizziness, and a loss or distortion of smell or taste.
Every day there are about 10 or more people who come to the hospital with persistent coughs and phlegm, and this is because of inflammation, such as bronchitis and laryngitis, that remain after we're infected with COVID-19.
Developing long-term symptoms, however, does not seem to be necessarily linked to how ill a patient was with COVID-19. British health authorities have said that people who had mild symptoms at first can have long-term problems as well. Similar findings have also been reported in the U.S. While children have been thought to be less vulnerable to the long-term effects of COVID-19, more are now being diagnosed with long COVID. Since anyone can fall victim to post-COVID conditions, here are some tips to ease the symptoms.
We would have to avoid excessive exercise or activities that may interfere with recovery and avoid beverages like coffee and alcohol. Also, if the symptoms can be eased with medication or treatment, prescription medicine can help.
More than 20% of South Korea's population has now been infected with the virus. The Korea Disease Control and Prevention Agency says it soon plans to carry out research on post-COVID conditions, as this could remain a concerning health issue even after the pandemic is over. Suk-hyen, Arirang News.